Um, Hello, students, and welcome to this session on continuing professional development. So, what are you going to learn in this session? Basically, we'll be having some information about CPD, that is continuous professional development, and what is its importance for all of us doctors. So, the objectives of my presentation would be first, of course, to define CPD and understanding what is continuing medical education, discussing the half life of medical education, what are the characteristics of CPD, its benefits. There also would be some barriers to CPD as with any other program or strategy. And since we'll be identifying the barriers, we'll also try to identify certain solutions. And finally, discussing also some methods of continuing professional development. So, what is CPD? If we consider the book definition, it's a very complex one. It's continuing development of multifaceted competencies which are inherent in medical practice. All of you now in this batch are part of the competency based medical education, right? Yours is a CBME. So it's a continuing development of multifaceted competencies which are inherent in our practice, which cover wider domains of professionalism and which are needed for high quality professional performance. So it's a very complex definition. Oh man, this is so confusing. And do we need to remember this definition? You would be asking. No, don't worry at all. You don't need to remember this definition. But to understand, so let's forget about this complex definition and understanding what it basically means, the concept of CPD. So I'll just put a small statement like when 3 million years ago, when the dinosaurs were stalking the earth, and then the moment when I talk of dinosaurs, what presumably would come into your visual image and the visual world, you'll start thinking of the Jurassic World and all those Tyrannosaurus and other Raptosaurus and all those dinosaurs and those four versions, the series of the Jurassic Park, right? But forget the movie and coming back to the species of dinosaurs. What makes us so fascinated about the dinosaurs, and why do the Jurassic Park movie itself get so picked up and it rocked the box office? The main reason was because this is something which once upon a time existed on this very world, on this very earth where we are living right now, and they gradually became extinct. So the next question that I would like to ask is, why did they become extinct? you know so obviously because of the Darwin's theory, they could not adapt to the circumstances, they could not pick up well, and that therefore, because they could not survive with the changing circumstances, changing climates, changing environment, and therefore they became extinct. So has occurred with so many other things. The BlackBerry gradually became extinct. The Nokia went out of market simply because they could not keep up with the changing demands and changing needs of the customers and the people around. And obviously, smarter things took way. And the iPhone and the Samsung, they're constantly evolving. You buy an iPhone 12 this month, and 2 3 months down the line you have an iPhone 12 Pro, and then you have a Pro Max and whatnot, and maybe next day you'll have the iPhone 13 or something else coming up, and similarly with the Samsung also. So technology is continuously evolving, things are continuously changing, so if you don't keep up with the change, you become extinct. Similarly, when I was in grade 12, I gave the typewriter exam, but many of you might not have even seen a typewriter. Then came all those uh, heavyweight desktops, but now we are using the smartphones and tablets, and now even the laptops have become convertibles. So again, things are evolving day by day, month by month, and year by year. So there is a term which means obsolete. That is anything. This is just on the humorous second, that anything which becomes, you've done last year or few months back, and which gets outdated and something new replaces it, then it becomes an obsolete term. So there are terms like outdated, expired, and obsolete. And this happens when you don't remain updated, you don't evolve, you don't adapt, you don't adopt to the changing environment and requirement. And that is what happens to your old technology. It just rests in peace, it dies out, it becomes extinct. And that is what happened to the dinosaurs as well. They didn't evolve, they didn't update themselves, and therefore they became extinct. So what do we do? If I ask you a question, you may just, during my presentation, you may just pause for 5 seconds and you may think, why are you here in the MBBS? What made you become a doctor? So you can just think for a while. Why do you aspire to become a medical student? So probably your reasons would be you wanted to do, the service to humanity, service to mankind, serve the poor, or the stethoscope hanging around the neck. It's so attractive, and you just like having a stethoscope in your hand, or you want to do surgery, you want to treat people, make people happy. There could be lots of things. Somebody feels that this is a very lucrative branch, it gives lots of money, and whatever. So different reasons, and that is why all of you are here together. So you want your degree, you want to become a doctor. But then my question would be, is that all? All of you would be wearing white aprons at the end of 5.5 years, having a stethoscope and a DR in front of your names. So is that all that you want to become? That's just a third of the way out there. Becoming a doctor or becoming a professional, getting a degree is not all. So, you in 20 years from now, do you just want to be a doctor sitting in that same old box, an older version, or rather, more appropriately, just an aged version of the same person who has graduated today? Do you want to be, after 10 years down the line, even after a PG, even after a fellowship, you still want to be what you are today? No, obviously not. So, you want to be a professional, rising up the scale, as you can see, becoming better, having more knowledge, getting more skilled, becoming more talented, and you want to be a true professional, of course. So we want to be what is seen in this picture, right? Not enclosed in a small box, not able to grow. So what more is needed? There is wherein continuing professional development comes into play. That is all types of professional learning. When I talk of the professional development, of course, that development has to be from a professional front. If you learn how to play guitar along with your MBBS, that is not professional development. Perhaps it may, yes, help as a stress buster. It may prevent your, the burnouts and all that, but ultimately it is not professional development. We are talking of professional learning, which is undertaken over and above or beyond the initial point of training. That is, you have learned something in your MBBS, you've learned something in your PG. Over and about that curriculum, that syllabus, what else you learn, that is professional development. So it could be a combination of different approaches, techniques, ideas, concepts, and whatnot, which will ultimately help you manage your own learning and growth. So, changing the definition to a slightly simpler form, basically, CPD is any educational activity which helps to either maintain or preferably develop or increase. It could be your knowledge, problem solving skills, technical skills, or simple professional performance standards, ultimately, with the goal of providing better healthcare. So it could be self-directed because, as I said, it is something beyond your conventional training. So it has to be self-directed. You have to do it on your own, and it has to be practice-based. You practice, you learn, you find out your gaps, your mistakes. Again, you learn further, and it is not a supervised training. Nobody says, "Oh, have you done this? You have not done this properly." You do it. You evaluate yourself, and you learn from it. And why is it important? Because in medicine, nothing is never. Like coronavirus, it would be, nobody had ever thought that it was never imaginable that there would be something like a coronavirus coming up and creating havoc across the globe and having a pandemic, it was not a never, it has happened actually. And again, it's certainly never always. It's not going to stay for always. We have the vaccine now, we have the treatments identified. So maybe not in 2021, but perhaps in 2022, 2023, it will go away. So nothing is never and nothing is never always. It's constantly changing in medicine. So let's see a small video. This is, of course, designed by the engineering people, but the concept of basically the CPD remains the same. So perhaps this might help you understand CPD better.
In a fast-changing world, it's important you continually update your skills so you can keep pace with technology and the environments you work in. Continuing professional development isn't just a box-ticking exercise, it's crucial to the success of your career. It helps you build confidence and credibility, keep track of your achievements, and determine your ambitions for the future. It's also how you demonstrate that you are enhancing your competence, part of the commitment made when becoming professionally registered. CPD needn't be a chore. The process is simple. Decide your development needs, undertake the learning in the way that best suits you, and then reflect on what you've learned. You're probably already doing CPD. It's anything that contributes to ongoing competence. Any learning that relates to the 5 groups in UK Spec is valuable. It can involve giving a presentation, preparing a report, or mentoring a colleague, or more formal learning such as signing up to a distance learning program or taking a course. It may include activities that happen outside the workplace, such as volunteering or private study. How you record your CPD is up to you. Your institution or employer may offer access to an electronic CPD record, or you may use your own method. Format is not important. What matters is that it's meaningful to you. You should take time to reflect upon your development by comparing what you've learnt with your initial objectives. By committing to CPD, you're assuring the public of your competence. Professional engineering institutions sample the CPD records of their registered members to demonstrate this commitment. Not engaging with CPD sampling means you could be at risk of losing your professional title, so it's important you're familiar with your institution's CPD policy. Take control of your CPD now. Visit engc.org.
So, as you saw from this video, it's very important that you identify your needs before engulfing into a CPD, activity, because there's so much to learn around all over in the world, even in the college, outside the college, and everywhere you go, you have something to learn about. So, out of all this, you need to identify what you want to learn and what will be beneficial to you. Then you can engage in that activity. Coming back to the healthcare system wherein we all are involved, we all know that there's a constant change here happening. New devices, new drugs, new diseases, new technology. Right now, also, again, giving the commonest example that is possible right now regarding the COVID scenario, we have the new drugs, tocilizumab and remdesivir, and the vaccines. Even in the vaccines, we have different types. In the different types, you have different technology, and so much is happening in the healthcare industry as well. And therefore, we understand that the half life of medical knowledge is actually very less. It has been found that any new information that we may gather, it has just a half life of 5 years. After 5 years, it has been found that it becomes old and outdated. And therefore, you need to have lifelong learning and critical evaluation of the new information. And lifelong learning is a very important goal which has been identified by the previously the Medical Council of India and now the NMC. So you need to be, as medical graduates, you need to be lifelong learners. It's not that, oh, 5.5 varas MBBS na pati gaya and now we are done with it. Let's forget MBBS. Or 3 years of post graduation has been done and it's over and done with. It's not that. You have to be lifelong learners. You have to continue learning day in and day out. Along with it is important is evaluation, critical evaluation of the new information, because as I said, there's so much of things, knowledge, skills, opportunities to learn available all around, that you need to be careful of what you are using and whether you're using the correct information, the correct data that you're getting, and whether it is going to be relevant and useful to you. If you just Google search or even on the YouTube video you search, learn how to play guitar, and there will be thousands of videos which will come up. So out of that, then you have to evaluate, identify which is good, which is better, how many reviews each has got, and what is going to be useful to you. Some may be electric guitars, some may be those other type of guitars and everything. So similarly for the medical knowledge also, there are lots and lots of resources available. So you have to critically evaluate what is useful and what is relevant. uh, Talking of the changing scenario, as I discussed earlier, what was called infectious hepatitis, now it is known as hepatitis A. Serum hepatitis, because it was transmitted through blood, now it is called hepatitis B. There was a hepatitis which fell none of the categories. So it was known as non-A, non-B hepatitis. Now it is called hepatitis C. So you see, even the terminology is now changing. The definitions are changing. Diabetes was earlier verified by just checking the presence of ketones in the urine. This you might perhaps learn in your biochemistry labs practicals. Now it is identified by doing a fasting blood sugar and random blood sugar, postprandial blood sugar, and your glycemic overall control is seen by checking your HbA1c levels. So a lot of things are changing. And again, coming back to the same thing, coronavirus has now, become so prominent. Earlier, it was in some small book of microbiome in one paragraph. It would be among the last few viruses which were mentioned. And but now, if somebody asks you name common viruses, 5 common viruses, the first that would come to your mind would be a coronavirus. Then this would be followed by, say, uh, immunodeficiency virus, then the herpes, then the adenovirus, and something else. So earlier, coronavirus was among the last in the list. It was even okay if you didn't mention coronavirus. But now this is the most common. So things are changing like anything in healthcare. 50 years ago, surgeries would be radical. If some tissue is found infected or cancerous, then everything would be removed. Now this is a targeted organ saving surgery which is happening. You try to salvage and save as much tissue as possible. New diseases are being identified. Because new diseases have come up, new medicines are there, new vaccines are there. So everywhere there is a change in the healthcare scenario, and change is inevitable. You cannot say that, oh, this is not going to happen, have a coronavirus I give, nothing else is going to come, so let's keep CPD at a halt. It's not possible. Things are going to change. The treatment of coronavirus itself, it began with HCQ, and then things kept changing and changing, and ultimately the drug that was finally found more effective was remdesivir. So change is inevitable. You cannot escape from that. So basically now CPD will allow you to demonstrate that you are maintaining your skill and you are developing professionally. It helps you to keep you up to date and competent in all the work you do. So you have to do it well. You have to address areas which require improvement. You have to explore new knowledge, skills, and behavior. You have to identify your own need. Perhaps what I may be lacking may not be relevant to you. I am an ophthalmologist. My requirements for CPD would be different. I am a faculty of a certain level. My CPD requirements would be different. An ophthalmologist, a junior faculty, would have a different CPD requirement. So you have to identify your own areas which require improvement. And ultimately, the purpose is to contribute to high quality patient care. Because, of course, we ourselves, it is going to help us also. But ultimately, why do you want to remain updated? Because you want to provide good patient care. Because ultimately, the patient will also come to you because you are updated, you are more knowledgeable, you are aware of the different new medications and different techniques. And therefore, the patients would be well treated by you. Other benefits, as I said, could be individual. It helps you to build your own confidence and credibility. It helps you to achieve your own career goals. It helps you to cope positively with the change. Things are changing. Suppose there are two doctors practicing. One knows COVID treatment, one does not know. So obviously, the patients who are COVID suspects, they would go to the doctor who knows about COVID. They'll not go to the doctor who does not know. So with change, you have to change, and it helps to be more productive and efficient. It helps you to address your skills and knowledge gaps, provides work satisfaction, because the better you know, the better you are able to treat, the more satisfied your patients are. That will obviously give you your own satisfaction. It prevents burnout also, because if you treat again, if you are satisfied with your work, you treat patients well, then you are happy. So all that stress of work is gone out. And all said and done, of course, because it gives you more work, your patients are satisfied, it gives you the potential to earn more as well. So, having again a small break, let's see another video about CPD, where various professionals of CPD.
So I've been in learning and development for about 25 years, and learning is changing probably faster than it's ever done. It's a critical part of you demonstrating your professionalism, commitment, but also it shows you're a consummate professional because you are keeping yourself abreast of changes in regulation, patterns, trends, societal shifts.
It is going to be different next month, the month after, and certainly next year. So we owe it to ourselves to maintain our capability and our professional standards by keeping up to date with what's going on there.
If you don't do any CPD, I think you're missing a huge trick, because if you're going to the trouble of learning something, you need to stop and reflect.
You're in charge of your own destiny. So you're in charge of your own career, you're in charge of your own pay rises, you're in charge of your own company that you go and work for. And yet we still wait for learning to be done unto us. It doesn't make any sense. Why would you do that?
But there's always then this dichotomy between CPD as required by the accrediting body and CPD that I might want to do personally to actually get better at what I'm doing. Getting a qualification is brilliant, but it then goes beyond that and thinking how you can find out about the latest theories or the latest thinking. Once you get into a continuing professional development mindset, it's sort of self-fulfilling energy source. You find good stuff, you put it to play, it helps you, gives you the energy to find more stuff and keep going in that cycle.
It can be quite exciting as well. I found people getting excited about it. I get excited about it even.
Anything that you do that is going to improve really what you're doing professionally.
And it doesn't have to be an onerous thing. I mean, I love watching like short YouTube clips.
Conferences are brilliant, not only because you get some good sessions, but you get to meet lots of people in networking. So that's a really great place to get CPD.
It's not kind of, a certificate or something like that, but it pays way more in terms of what it gives you back.
Sometimes it's a magazine, psychologies. I mean, who doesn't like to read a magazine, And so psychology quite often has really interesting articles, about how we learn or whatever.
It could be just a webinar, it could be attending an exhibition, it just could be reading a book.
Radio 4 is fantastic for like maybe some brain science stuff.
One of the things I think I am most excited about the future, I guess you'd say, for CPD as a tool and an approach is the use of digital. It's really important to find ways of engaging with that content.
My biggest thing is Twitter.
I go on Twitter sometimes and follow somebody's blog that's got something interesting in it.
Get a sense of the sort of the zeitgeist, the things that are going on in the industry that's different, where it's changing, where it's moving forward.
Get yourself a personal learning network. Find people like you. Find like-minded people and have conversations.
And obviously DPG, you've got your own communities running there, which is fantastic. But there's many communities that you kind of need to hang around in where you can interface with people who've got really good ideas. So that's really important. You can share that content with other people are professionally aligned to the world you're in or similar. And then what you'll find is that you'll get some back from those people too.
You will still have things to offer. So even if you are a young person and you may not have been in the workforce, you'll have done stuff. And so share upwards, do that whole reverse mentoring thing as well. Because that way you'll just build a bigger network and you'll validate what you've done already, validate those things that you think and form more opinions.
But I get back some stuff which I wouldn't have found. It's more useful in certain areas and stimulates a different path for me. So, sharing's crucial. At CIPD, we're looking at a product early next year called The Future of Learning, where we're going to provide curated content and communities where L&D professionals can hang around. So I guess for me, networking actually is probably one of the really important ways of doing it these days. Write a reflective blog or build a summary slide deck that you would post on a social network. So the blog and the slide gives you a chance to think about what you've heard or received as new information, how you've applied it if you have, what the outcome of that was, and kind of make sense of it.
Bring it back to this reflection you've had about what worked, what didn't for you, and what you'd like to do differently. Because the more personalised your learning can be, the more it will help you to do your job better, your job differently, the more you're going to commit to getting the results that you want.
The reflective bit in digital helps you start like a library of your own content. So you can use tools like Evernote, Scoop It, and all that kind of stuff to curate content that's from the web and also from you.
You need to stop and reflect to actually then acknowledge and explicitly sort of say to yourself, I have learned this thing.
Make it a normal thing that you do, habitualize it, don't make it a sort of an add-on to your week or month.
We don't want it to be a box that you tick in March because somebody's going to ask you at the end of the month what you've done this year. We want it to be a process which genuinely helps you to do your job better. Makes your life easier, helps you to work smarter. Starts with a reflection about what do I need to do differently and how can I learn from those experiences.
So from that video, it was like quite clear a few concepts that there are lots of opportunities to go for CPT. And the basic thing is to identify your own needs. There are a lot many opportunities and scopes. So you need to identify what is important for you. And again, don't leave it like the last person said, don't leave it till the end of March, just because now you have to submit your assignments or what have you done, or you have to submit your CV. You start doing activities at the last moment. So just make it a plan, keep it a continuous process and keep doing it day in and day out. So that brings us to the characteristics of CPD. That is, it's not a one-shot deal. Okay. So suppose for those who are eating in the mess or for those who have the tiffins from home, this is your daily menu, the same Gujarati traditional lunch every day, Monday to Sunday. So obviously you would get bored, right? So you ask your person in the kitchen in the menu, कि भाई कुछ नया बनाओ, this roti dal बहुत हो गया, make some South Indian or Mughlai or something. And then he says, okay भैया ठीक है दीदी, I'll change the menu. And then every morning he starts serving you the uttapam with the classical three chutneys. So again you go every morning, Monday to Sunday, it's the same old thing. And you said कि भैया ये क्या किया है, तो what will he say? आपने ही तो बोला था चेंज करने को, मैंने मेन्यू चेंज कर दिया. But this is again not what you want. What you are looking for is something like this, right? You want a variety of food, sometimes South Indian, sometimes North Indian, sometimes fast food, sometimes you just feel like having nothing but just Maggie noodles or sandwiches or something like that, just French fries. So what you want is a variety, right? You want a change, but you also want that change to be changing. So the characteristics would be, it has to be, the CPD has to be variable and it has to be continuous and ongoing process. Like that person said, don't do it just at the end of March, at the end of a financial year, at the end of a calendar year, that, oh, now in this December month, I'll finish all my CPD. No, it has to be a continuous process, an ongoing process, and it has to be variable. It has to be regular too, and it has to be continuous. Only then actually it serves a purpose. And it involves follow-up and a support for further learning, because again, as was said in the video, a reflection is very important. You need to identify that what you wanted, has it been served through those CPD tasks that you have done, and what is now the scope for further learning. That one CPD activity might perhaps generate new knowledge gaps and a need or desire for learning something more. So that opens up an avenue for a second CPD. The content could be, ultimately it has to focus on good professional practice. Whatever activity you are engaging it has to focus on your professional practice. As I said, we are not talking of learning guitar or learning cooking. It is basically related to a medical profession, maintaining good medical practice, developing or enhancing, maintaining relationships with patients. So it could also be related to ethics, it could be related to professionalism, related to communication, counseling, working with colleagues, how to work with colleagues, how to do good teamwork, developing leadership skills, time management, all that could also be part of a CPD. It could be related to teaching and training. Those who are, very fond of teaching, they make videos, you might write blogs or something. So activities could be focused on that also, or it could be simply focusing on public health and medical, purely the academic and medical related part. So the CPD cycle basically starts from identifying your objectives and planning how will you learn. Then once you have learned, means you identify, then you actually learn it and implement it. From that, it is very important that you reflect and evaluate. What have I learned? How is it that is going to benefit to my practice? Okay, I learned something. I learned a new technology of cataract evaluation. I learned about a new medication that has come into the market. I've learned about Covishield and Covaxin, but then what? How is it going to benefit my practice? How is it going to benefit the patient? So that is what next I have to plan. Can I prescribe the new drug to my patient? Which category of patients I will use this new drug? So I need to identify those patients also, and you need to monitor them for side effects. And ultimately, you reflect back now on your practice. Okay, now what next? What is the next CPD that I will do? This patient has developed this side effect. The new drug I identified, I prescribed, the patient has come with the side effects. Now what? So then again, it goes to a next CPD that I'll attend some more activities regarding that drug where they're discussing more about the side effects. I'll try to search the literature for that. And then, so it leads to a second activity, and the cycle goes on. So the activities could be formal or informal. Formal are like webinars, events, programs, like what you're doing right now. If you attend it on a larger scale, somewhere a talk is going on CPD and you attend that. So that could be a formal event. You attend conferences, or it could be simple informal information like exchanges on tweets, blogs they were talking of. The digital media actually plays a very, very important role. You can have academic WhatsApp groups also. WhatsApp we may forget because of the privacy issues. You can have Signal, Telegram, or whatever else. So you can have those academic exchanges also, mentoring, reverse mentoring. You can be part of different committees, wherein again, because of the role that you're given, the responsibility that you have given, you might have to learn something, some skill, or you may have to gain some knowledge about that. So that are all informal opportunities. You discuss with your faculty, you discuss with your seniors. All those are informal exchanges. They are also ultimately professional development activities because they are enabling you to become a better professional. So, and what are the resources and sources? It could be almost anything. As I said, anywhere, everywhere you go, there is always one learning opportunity available. It could be a school, university, PG institute, professional organizations, scientific organizations, health authorities, or even the pharmaceutical, medical, technical industry. Almost any place you can become member of different organizations. Anywhere you go, there will always be some learning opportunity available for you. You can go through textbooks, medical literature, journals. You can go for short term courses or long term training programs. You can enroll in workshops, attend educational meetings like conferences, panel discussions. There are lots of webinars nowadays going on, especially the pharma people, they're indulging in so many webinars. So you can attend webinars of your interest and according to your convenience. You can have information from media, as I said, lots of information now available all over media. And again, exchange of experience with colleagues or faculty. You can, some faculty is specializing in something and you are interested in that, so you can simply have a discussion set up with them, and you can ask them their convenient time and go and sit with them for half an hour and learn about that. When talking of media, let me make one thing again very clear, that as I said, lot of information is available everywhere. You type something in Google and Google will give you lakhs of results. You open up Facebook and you put a post, you'll get lots of information on that. Even different types of blogs are there. Critical evaluation is very, very important. See that the information that you are getting is authentic, that is, it is accurate, it is validated, and it is relevant to you. Because sometimes the results may just pop up because that word is there in their content, but it may not be very relevant to what you want in your scenario. Like something happening about a vaccine in some other country may not be relevant to an Indian scenario, or especially talking if Gujarat, Ahmedabad, and MBBS learning. So you have to see whether that content is relevant to you. So please do a critical evaluation of all the resources and sources and then use it. As I said, there is nothing without a barrier. So barriers could be there for the CPD activities. One is the time. After my talk you will be feeling, पर मैडम टाइम कहाँ है, 9 to 5 तो कॉलेज रहती है, ऑनलाइन सेशंस रहते हैं, फिर कुछ पढ़ाई रहती है, एंड देन फ्रीकिंग आउट विद फ्रेंड्स, डिनर और समथिंग, घर जाने में आधा पौना घंटा ट्रैफिक में लगता है. वेयर इज द टाइम फॉर अ CPD? So first and foremost barrier would be time. Second, of course, expenses to some extent, because especially when subscriptions are involved, physically attending conferences are involved, certain courses and workshops may have their fees to be paid. A support system is necessary, even personal commitments. You have your girlfriends, boyfriends, spouses, families, you have responsibilities at home, and especially when you after a certain age you are married, and your spouses will tell you कि Monday to Saturday तो काम करते हो, तुम्हारा PG रेसिडेंसी चलता है, संडे भी कॉन्फ्रेंस करने की, संडे भी ये वर्कशॉप करने की, एक संडे तो हमको दिया करो. So again, you'll have personal commitments coming up into your way. Workplace responsibilities, again, you may have added responsibilities, especially if you're very active and you're very good in your work, you may be assigned different responsibilities. And your own outlook and attitude is very, very important. That should be the top priority, because unless you want to do a CPD, you want to indulge into becoming better professionally, nothing else would work. And a lack of opportunity. But at the same time, if you see, none of the barriers are like that which cannot be overcome. So you have to find the solution how you are going to overcome that barrier. So coming to the time, of course, time management is important. You need to prioritize your work, see what is most important today. Avoid procrastination, try to meet to all deadlines and everything. So time management will help you to overcome that barrier. Expenses, you can try to share expenses wherever possible. You can have groups of people, your friends together doing sharing for some expenses. Support system, again, try to identify your own support systems, friends, peers, faculty who can help you. Personal commitments and workplace commitments, again, it actually can be helped to a large extent by time management itself. Divide your day into different segments and try to prioritize your things. Outlook and attitude, you have to change it yourself. You have to be motivated enough, and you need to understand the need that yes, I want to become better professionally, and I want to become a better doctor. I don't want to be a doctor, I want to be a successful and a better doctor. So your own outlook and attitude has to be there. You need to have that burning desire inside you to do better and do more. And lack of opportunity, again, it's almost never there. As I said, there is always an opportunity to learn more. You just have to identify that opportunity and grab that opportunity. That's all. Again, as was said in one of the videos, recording your activities is very, very important. So keep a record book, develop your portfolio. Again, portfolio is going to be part of your new CBME system. So basically, you have to document everything that you have done. So it will not only remind you what you have done, it will also help you to create opportunities. You note down something and you realize that, oh, perhaps if I do this also, which is in addition to this one, it could be better. Or this short term course I have done, now perhaps I can go for a long term course on the same topic also. I have found it useful. So it will create new opportunities for you. And if nothing else, it will at least help in documentation and your uh, improvement of the CV. Because sometimes when you go for an employment purpose, you'll have to submit your CV. So in that, you can mention all the important CPD activities that you have done, attended workshops, attended conferences, participated in conferences, done some courses or something. So all that, if you have documented, it will help you to improve your CV and make it look richer. So today, start making a to-do list. That is, what are the activities you are going to do regarding whatever you are going to learn in your MBBS course, because you cannot do a CPD activity regarding your MBBS course when you are in PG. You cannot do about a PG when you are doing your fellowship. It has to be parallel. So today you have learned something, in this week you have learned something. Identify if something has interested you very much, then try to explore the world. That is, what more can I learn about it? It has to be, as I said, it has to be parallel, it has to be continuous. So to conclude, you and me, all of us as doctors, and you as future doctors, you are responsible for keeping yourselves up to date in all areas of practice. As that lady said, you make your own destiny. So if you don't want to be outdated and extinct, you have to keep yourself updated. What you will learn here in these 5.5 years of MBBS, later during PG training, it has to be updated throughout your life so that ultimately it reflects your practice. And think carefully about all your learning experiences so that ultimately you are able to provide the highest quality patient care. Every year, make this your goal. Be a better professional than you were the year before. Try to be better and keep going up that graph. Part of being a professional is, it's not only, as I said, not only being a doctor, but a doctor who is growing and staying current. That is very, very important. So don't be a dinosaur. We don't want to see all of you in a Jurassic Park movie or a series. Stay updated and stay up on new information. Adapt to your circumstances, adapt to the changes that are happening in the medical field and in the healthcare sector and in the professional field, and stay successful. So again, coming back to my original question, would you want to have a treatment or surgery with a doctor who has graduated in 1988 and still uses the same medicine or technique? So talking, I'm being an ophthalmologist, talking of the most physiological surgery anyone could have, such as cataract surgery. So would you want on yourself or for your parents a doctor who has graduated early on, still uses the same technique, takes 8 to 10 sutures, and doesn't implant an IOL? Or you would like to go for a surgery who, with a doctor who is very skilled, knows the best of the technology, use the highest of the best equipment, and does a nice sutureless surgery with the most advanced IOL? So that answer itself would tell you whether CPD would be important for you or not. It's coming to a last video, which shows how the medical sector and healthcare sector have changed.
Picture today a surgical scene. Sterile room, bright lights, instruments clean. Patients today know they'll be safe. But long ago, this was not such the case. What once was called surgery was nothing of sort, and began when such things were of desperate resort. From the new Stone Age, 4500 BC, where holes drilled in skulls were the best you would see. With these crude efforts and noble intentions, only turpentine and vinegar might stave off infections. And for these poor patients, through their howls and their groans, nothing there offered eased the slicing of bone. Flash forward some years to the ancient Egyptians, learning of organs through mummifications. 'Twas known that honey kept infection at bay, after their saws and forceps had had their way. The Greeks also made tools for their own resections, and found that wine helped ward off infections. Gladiators thrived with Galen around, who studied the body, slicing on beasts that he'd found. Clearly, surgery before anesthesia was simply barbaric, excruciating pain making patients hysteric. But this was a time to be awake was thought key, to come out alive of your surgery. In India, years later, across all the land, nose upon nose was sliced off by hand. As punishment, yes, but which was the worse? The loss or the cure, nose stitched back with force. Through the Middle Ages, this agony of pain continued, leaving the needy writhing in vain, as concoctions of herbs attempted to mask the unspeakable agony of resolute surgeon's task. Here soon emerged a brand new vocation. Barber surgeons pulled teeth and did amputations. Inside of their shops, your wounds he'd repair, and for a spare shilling, he'd trim up your hair. At this time in large cities emerged a disease that would rot off your face while spreading with ease. Quite the scandal, but surgeons and skin grafts could save you in weeks, though by stitching their arm to the side of your cheek. But here education humbly begins, to improve how surgeons could heal their kin. Those students were faced with dubious terms, forced to steal cadavers, to dissect and to learn. Finally, from darkness, a turn that advances, with the arrival of chloroform, ether, and gases, which tamed the edge of all of this pain, though significant risks of dying remained. But then new technologies wrought realizations, like how gloves made of rubber could aid sterilization. And through a germ theory, new insights arrived. Why, simply washing one's hands could help patients survive. So, by the mid-1900s, surgery was safe, antibiotics having found their true place. Amongst better schooling and doctors who shared the skills, yes, to heal, but also to care. Now the term healthcare means thousands of tasks, thousands of roles built on the past. And with esteemed institutions teaching what's right, the history of surgery's future is bright.
So through that video now, you could see that how surgery evolved over years from the Stone Age to the current. And earlier, honey and wine were used for asepsis, and how gradually it changed to hygiene and cleaning and use of hand gloves. So again, coming back to that same question, just think whether you would want a treatment or a surgery with a doctor who belonged to the Stone Age, or you would want somebody who is more updated and skilled. So it goes now without saying that CPD is definitely very necessary for good medical practice. It has to be a core component of your entire professional training. It is not going to happen within the classrooms, supervised or done by somebody. You have to do it on yourself, and you have to remain motivated for yourself. Thank you so much, and I hope you all stay motivated for CPD, and all the best for your further sessions and for your career. Thank you.